All right, so thank you so much, Nurses Notes, for asking this question. Are you the first nurse to go there? No. Did you have a history to review to see if the patient case can be taken on by myself, basically? And I would say I did review the notes, but if you know, a lot of times we document things and the documentation is not clear, and your channel is Nurses Notes, so obviously there is something that you're bringing across in terms of with Nurses Notes that people need to get understanding of. And I realize that a lot of times, especially in house call here, in house call service, because it's a case where I feel as though a lot of persons are probably just there for the money sometimes. We don't spend the time and document as much as we possibly can, because you're just saying, oh, I'm just going to see this patient one time or two times and that's it. Copy and paste things. A lot of people don't review what they're copying and pasting, and they don't make the necessary adjustments to reflect the patient status. I noticed as well that there wasn't any consistency with that patient because it was more of a televisit. They did a lot of televisit, but I'm the kind of person who loves to go in and see the patient. So even if I go in and the patient's home is in a total mess and I feel as though I am not going to go back there, I love the comfort of knowing that when I document on a patient, it is a true reflection of what the patient is, because at least in the end, I can always say, this is who I saw based on the notes, because later on, we might not remember anything about the patient, you understand? And I just have to rely on my notes itself. So definitely, I always review my patient's notes, but as I say, there are certain things that are not documented. And as nurses, we need to get into the habit of doing this, because if we don't do it, we're not going to be able to protect ourselves. We're not going to be able to protect other persons, because key information such as, how the patient, appears in the house or the home environment itself, safety hazards that need to be highlighted were missing from that chart. Because when I go in and see a patient, for example, if I notice that there's a pew, that's what we're calling it now. We notice that there's a pew, I'm going to make a little notation of the fact that there was a little pew and why I feel it's unsafe for me personally if I am not going to go back there. Or I'll just make note of those things on the chart. So as soon as you open the chart, so you see pop up to say there are dogs, there are cats, there's a pew, there is, the gentleman is just aggressive, argumentative or anything like that. So you go there, this might happen because of, previous experience. So it's very important as nurses to make sure that we review the notes before we're going to see these patients. Anything that is very pertinent, go ahead and highlight it, leave it in the notes section, and make sure we're documenting things that we see in the environment. Every single thing that you document goes together to make this assessment for the patient. And it's not only for the patient, but you're also helping yourself as well as other colleagues that are going to be coming along with you after you visited. And that is a very good point, because as I say, that is something that I've noticed that a lot of persons tend to do, because sometimes you might see it's a patient that is a male and you might see a representation of a female notes. You understand? Talking about a transgender here. We're talking about the fact that we don't sit down, and even if we're copying and pasting, we don't sit down and take the time out to say, okay, then let me review it and make it be reflective of the patient. And that was just the situation with this one, along with the fact that there hasn't been any visits after for a long time. Some of these patients in house call service, they haven't seen a nurse practitioner or a provider, let's just say, for a long time. And you don't have, depending on the company that you're working with, sometimes you don't have that consistency with home health providing update to the company. So when you as a nurse practitioner go out there for the first time, you're being greeted with different things that you probably didn't want to, see or visit or be a part of. But for me, if I'm already there and if it is safe, yes, there was a pew. If it is safe, I will definitely go ahead and just finish up the assessment and just step out. You understand? And don't make it be something that I discuss with the patient. Because, sometimes it can become very argumentative when you start talking about, the need to put away this. But definitely, those are things that we need to definitely think about when we're doing house call service. Make sure that, whatever you document is a reflection of the patient and it protects you as well as other persons that are going in the home to provide the service for these patients. All right, bye.